Hello to all the viewers. With me, I have Dr. Sahaj Agrawal, who has secured rank 5 in the AIIMS merit list and rank 15 in the common merit list of the INISS DM Neurology entrance exam. Sahaj, I personally know him for some time now. I have seen how hard he has worked over the last 1 year. So, Sahaj, hearty welcome
Thank you, sir.
and a big congratulations as well.
Thank you so much, sir.
So at this moment, being rank 5 in AIIMS, what does it feel?
I have never dreamt of this, that I'll get a rank 5 in AIMS, sir. I've never thought that I could even go to AIMS, sir. I was like, okay, I can get a good institute. I have never thought that if I could have, it was always a dream to go into a central institute, but I've never thought that I'll achieve it. I always thought that, okay, I can get a good institute, but never thought of a central institute, sir.
Okay.
It was just a dream, sir.
Yeah. Can you just tell us where you did your MBBS and MD from?
So I did my MBBS from SMS Medical College, Jaipur. I joined in 2011 and completed it in 2017.
Okay.
Then I joined my MD in General Medicine in Sardar Patel Medical College, Bikaner in 2018. I finished it in 2021 on this.
Now, whenever I think of Sahaj Agrawal, the first thing that comes to my mind is the word persistence. And there is a reason why, which Sahaj himself will tell you all. Sahaj, just go through the last few months. Your NEET SS rank was around 300s, right?
Yes, sir. Yes, sir. My rank was 308.
308. So at that time, there were lots of confusions, apprehensions, whether to take a seat, if yes, where, which institute, if you go for DNB, which institute. So, but still you had that INA also in mind. So just take us through that particular phase.
Sir, when the result for the NEET SS came out, so I wasn't very happy with my result. Like I was not sure that even if I should take a seat or not. Then, sir, my wife pushed me back to prepare for the next INI. That it is in April only, so we have some time to join the college as well. So let's prepare for the INI. So she kept pushing me that, okay, let's prepare it, let's prepare for it. So that's how I started again and started opening everything, my books again. Like I have kept the books aside after the NEET SS. Okay, that I'm done now. But then I again started again for the INISS, and then it happened the way it happened. Sir.
So Sahaj is not just any neurology aspirant. He has a special interest in neurointervention as well.
Yes,
which
sir.
is why after his NEET SS results, he was initially planning to take a seat. He wanted to know which institute offered the best hands-on training in neurointervention as well.
Yes,
so
sir.
He's somebody with a clear vision. And though he eventually decided to take a seat via NEET SS, but he told himself, let me just try for INI. And eventually here he is, rank 5 in the AIIMS merit list, which is why I said we should all learn this persistence from Sahaj. Because many a times what happens is some candidates might have got this rank. They know it's the INI is a couple of months away. They know that if they can put that extra little bit of effort, probably they might get it. But they might be contented with what they have, and that extra inch, extra effort might be lacking. And for Sahaj, that extra effort made a big difference, right, Sahaj?
Definitely, sir.
Okay. So Sahaj, just tell us about your journey with DocTutorials. Approximately when did you join DocTutorials and how has the journey been?
So, sir, I joined DocTutorials somewhere in August 2020. Okay. So initially I joined with the test series and the question bank. Then initially there was a change in the pattern of the exam. Like in October, it came out that the pattern will be now based on general medicine. Then again, it get back to the 60-40 of the subject-wise pattern. So then I started watching the videos and I finished the videos before the previous INI exam, sir.
So you have watched almost all the videos?
Yes, sir. I watched all the videos and previous exam videos also, sir.
So how helpful were the videos for the exam pattern, that is the current INISS exam?
Sir, the videos were like, I read the Harrison before seeing the videos, but it was like I didn't get the complete orientation of the subject, sir. after watching the videos and then I read the Harrison again, so I was oriented, okay, now what I'm reading. So the most important thing was like your videos helped me to orient to the subject and what to emphasize on, sir, what tables and what everything I need to study, sir. Then this was the main helpful thing for me, sir, for the videos, sir.
All right. And in DocTutorials, what we did at the time of structuring the program was that we had a specific plan not to just give any recorded lectures alone. We should give some exams, and that also with a definite timetable. So we had conducted the Elite exam series, and for neurology, we had conducted individual topic-wise exams as well for all subjects. We had conducted. So like we had separate exams for movement disorders, seizures, and epilepsy, then dementia, neurocritical care. So the thing is, it would give a candidate short targets. Because if we just ask them to write grand test alone, it's like preparing the whole of neurology. So how did these Elite exams, topic-wise Elite exams help you in your preparation?
So the topic-wise Elite exams, first of all, made a schedule for us. Like within a specific time period, we have to complete this subject and we have to appear for the test for it. Before that, it was just arbitrary preparation, sir. Like today, I'm studying a stroke chapter, then I'm going for a seizure chapter, but it wasn't a general preparation, sir. When the Elite test series schedule came, so it was like, now I have to finish this topic within this time period. So it was all structured preparation for us, sir. That helped a lot, sir, to complete the course. Otherwise, it would have been like I would have skipped some chapters and didn't do, and the part which I didn't cover, which it also helped me after the Elite test series, like the test I gave, and I didn't complete that part. So I read that part after that test, sir.
And what was the level of competition that you had in the Elite exams, and how did that motivate you?
So the competition in Elite test series was just like the competition of the exams, sir, because all the rankers of the exams were giving the tests. So I actually got to know my exact position where I am in the Elite test series, and that position replicated in my exam also, sir.
Now, Sahaj, once the results came, you were qualified for the interview. So at that time, the ranks were not out. It's just that you were qualified. And how was your preparation for that interview in that 7-day gap between the announcement of the results and the interview? How did you prepare?
So, sir, as soon as the result after the first stage of the stage one came up, so I started. You made us the WhatsApp group for the interview session, sir. So I started, and you gave us the list of the topics what were asked in the previous questions, sir. So that helped us a lot, sir, because I wrote them on the paper and I started doing those topics point by point. Like, okay, I have to do this, and also I was preparing according to that topic only. Like I wasn't going deep into the topic. I was just like, if it's there, how to approach patient. So I was preparing like approach a dementia patient. I was not preparing it going into a Alzheimer into a TEP. So that helped us a lot, sir. And again, after that interview, during the mock interview sessions, what questions you were asking, sir, those were exactly the same questions they were asking there, sir. And the way they were asking, it was all same, sir.
Yeah. So basically, for the viewers, in that 1 week gap between the result announcement and the actual interview, we had conducted multiple mock interview sessions, and we had conducted a WhatsApp group in which majority of the candidates who actually attended the final interview were also there. And I had shared with the candidates all the previous year interview questions, which I had collected from my previous batch students. So Sahaj, tell us what difference the interview made, because I can see that from a position of 15 in the common merit list, you have jumped to 5 in the AIIMS merit list. So which means interview is also something that can make a difference, right?
Definitely, sir.
Yeah, because
sir,
that is very,
it's all about like how do you prepare for the interview, sir. You kept on speaking about like prepare yourself to speak up, either in the mirror or when you were sitting. So that's what I was doing, sir. Any answer I prepare, it was just like my old school days, sir. Like I remember the answer and then I used to speak it with myself or speak it to mirror. So preparing, that was a different part, sir, like than preparing a MCQ based exams.
How do you assess the INI paper? Because it seemed slightly different from the previous INI question paper. So can you just give the viewers an overview of the type of questions asked in this exam?
Sir, INI exam, it is 80 question exam. So around 55 questions were from neurology and rest were from general medicine. Neurology part, sir, the previous INI a bit tougher than this because it had long stem questions and long stem options also, sir. Not just the question, but the long stem options. This time, sir, it was more of a factual questions for neurology. In general medicine part, sir, the difficulty level for general medicine was same in both the INIs. It was the basic NEET PG level general medicine. Plus, the questions were framed like how the cases we see in our daily general medicine wards, sir. Like there was a question on diabetic ketoacidosis, or there was a question of a marathon runner. So those were the cases like what we see generally we see. They were not like a very question is into a depth of a general medicine or something like that. They were basic general medicine questions, sir.
All right. So what I want to tell the viewers is also the same thing. See, what Sahaj told us was that the previous INI had long stem clinical questions. This time the exam was a bit on the easier side, but even when there is an easy exam, the chance of making silly mistakes is more. Okay. So whenever a candidate prepares for an exam, be it INI or NEET SS, you should have a good range. Because if you just prepare for long stem clinical questions, when an exam turns out to be more factual, you might find it difficult. The same happens if you just keep preparing for factual. If it is long stem clinical questions, then you are in trouble. So which is why in DocTutorials also, the video lectures we have started from the very basics. The elite exams, we have kept it as a mix, some from Harrison, some from clinical scenario questions, whereas the QBank is on the tougher side. Most of the questions are from Bradley. Okay, a tougher QBank is there. So this spread is because no one can exactly anticipate the pattern. So had it been a scenario where INI SS we know, okay, it's only about long stem clinical questions, then you can go for that. But it's not the case. And that is what Sahaj says. You should have a good range. Your preparation should be according to that. Now, Sahaj, for the candidates who have joined medicine residency, maybe they are in first year or second year, what advice you want to give them? Because like you, many of them will be aspiring to learn neurology from a central institute. So what do you think went right for you in your journey through your residency and your preparation phase? What advice or motivation you want to give them if somebody aspires to be in a central institute?
Sir, who is in general medicine or any other branch and he's in the first year or second year, I'll definitely like them to focus on their core subject first, sir. Because even in the interview also, sir, it happened to me, like they asked me a case of a 35-year-old female who presented with weakness. So things what I have seen in my wards, those things came first in my mind other than things I have read, sir. So those clinical things help you a lot in your preparation for the exam also, sir. So first of all, I like them to focus on their clinics as much as they can. Then at least stick to Sir Harrison. Harrison is a must for everyone who is preparing either for NEET SS or for INI, sir.
All right, which is a very important message. Now, I completely agree with what Sahaj has told because see, when you are a medicine resident and you are just joined, at least some residents would have a thought process like, okay, let me just prepare for super specialty. I just want to become a cardiologist. But if you go with that mentality, you are likely to have a very small tunnel vision. But remember, if you become a cardiologist or a neurologist, whatever specialty you take, your basic knowledge of other specialties is also equally important. You cannot just become a neurologist and say that you do not know to read an ECG or you forgot to read an ECG. So as Sahaj rightly said, please focus on your medicine first. And from there, develop an interest for a particular super specialty and then prepare accordingly. Right, Sahaj?
Yes, sir. Definitely, sir.
And finally, just tell us, what are your parents feeling now? Because I know there were moments of uncertainties, everything going around. At this moment, how is everyone at home?
Sir, they are like overwhelmed with this result, sir. Everybody is so joyful at home, sir. It is like a festival at home now, sir.
Okay. So it's a big festival because see, getting into AIIMS Delhi is a big achievement. And I'm happy that you could achieve this with so much of hard work, and really proud of you, because I say this honestly because I have seen many candidates after a particular failure in an exam. You can call it a failure, but just a temporary one, but they just giving it up. But you told yourself, let me give myself a try and see how much difference that has made. So thanks a lot, Sahaj, for joining. A really inspirational interview for everyone. I think those who are listening to this would have got motivated also from his journey. So thanks a lot, Sahaj, and
Thank you,
wish
sir.
you all the best. Thank you.
Thank you so much, sir. Thank you, sir.